National Health Insurance Fund is broke and may not meet its obligations if the negative financial performances is not dealt with. A new report by Auditor General Nancy Gathungu shows the National Health Insurer has a funding gap of over 3.6 billion. The fund's performance has dropped compared with the financial year 2017-2018 when it earned an extra 295 million shillings.
Gathungu warned that the fund's performance is on a downward trend, and if strategies are not in place to reverse the trend, the fund is likely to experience financial difficulties in future. The deficit resulted in a reduction of the fund's earning from 23 billion shillings it posted in the year ending June 2018 to 19 billion shillings in the year ending June 30th, 2019. NHIF's performance has been a cause of concern for many leaders, with calls to the government and the fund management to get a lasting solution. During the NHIF membership registration drive in Mombasa in July, ODM leader Raila Odinga decried the situation of the fund failing to meet the hospitalization needs of Kenyans. The former Prime Minister lamented that a number of Kenyans were avoiding going to hospital because they fear the costs associated with the services. Raila said that with the current pandemic, hundreds of Kenyans have died simply because they could not afford hospital fees. He argued that the chance of a greater segment of the population dropping dead from illness is one infection away. Odinga said that Kenyans deserve insurance subsidies that come with both inpatient and outpatient needs in hospitals. The challenges with NHIF have been blamed for slowing down President Kenyatta's universal health coverage plan, which is among the pillars of the Big Four agenda. The UHC dream has yet to succeed despite its roots being traced to the NAC government in the botched amendments to the NHIF Act by the then Health Minister Charity Ngilu. The NHIF management has attributed the fund's loss-making woes to the fact that millions of Kenyans have left their accounts dormant, as only 5.1 million accounts are active out of the registered 10.4 million. Chairman Lewis Nguyai, in pushing for individuals to activate their accounts, once told a meeting in Nairobi that NHIF pays 2 shillings for every shilling received by a member. MPs are currently processing a bill that is hoped to remedy some of the stumbling blocks to the UHC agenda. The NHIF Bill 2021 seeks to provide that the national and county governments be liable contributors for all public and state officers under a national health scheme. Private employers would also be required to top up their workers' contributions to ensure the total amount is not less than 500 shillings in efforts to raise more cash. The proposed law currently before the Senate also sought to stage mandatory registration for persons. who have attained 18 years. Away from the concerns that the insurer is cash-strapped, the Auditor General has flagged some transactions pointing to possible loss of cash. Among those flagged is 1.4 billion shillings that was paid to the drawings and design of a proposed resource center, which was to be built in Karen, Nairobi. The project is yet to start 15 years later, following a land row whose resolution remains uncertain because of a court case. Gathungu said taxpayers paid an extra 3 billion shillings in the construction of a multi-story car park operated by the fund. The project commenced in 2003 at 901 million shillings cost, but was completed in June 2011 when the total expenditure was 3.9 billion shillings, being 337% more than the original contract sum. Gathungu said that the cost escalation was not justified. She also noted that although the issue has been discussed by the Public Investment Committee, no action has been taken on the committee recommendations. The parliamentary committee had recommended that the Director of Ethics and Anti-Corruption Commission investigate the project with a view to preferring charges against those found guilty of any wrongdoing. NHIF has also been put on the spot of a 340 million shillings loan it advanced to the Moi Teaching and Referral Hospital at an interest rate of 3%. The Auditor General questioned why the loan has not been supported by a loan agreement between the two parties. Waris Kimathi, Look Up TV in Nairobi.